Elise Brock. I am the Operations Director for the Global Resource for Advancing Cancer Education. And we are talking today with Sheila. Sheila, would you like to introduce yourself?
Hi, I am Sheila Marie Johnson. I am a 25-year Air Force veteran, a mother of a 33-year-old daughter, and a 3-year-old cane corso. That's my dog, Duchess. And I have been living with metastatic breast cancer for the past 13 years.
So you were diagnosed in what year? In 2009, is that correct?
Yes, December 2nd, 2009.
And how was your knowledge base when you were diagnosed from the beginning?
It was zero, and I look back on it because my mom died of metastatic breast cancer. Well, I say cancer stole my mom, but she was diagnosed with metastatic breast cancer in 2004, and 5 years later, I got the awful disease or diagnosis that I had it. And I knew about breast cancer, but I didn't know really Black women could get breast cancer because on the commercials, you only see older white women.
Mm-hmm.
And when my mom got it, I was just like, Black people get breast cancer, you know? And then when I got it, I was 43 years old. So yeah, it was zero knowledge. So yeah.
How did
Go ahead.
how did you get diagnosed? Were you in for just a regular checkup or?
No, actually, a sneeze is how I found out I had breast cancer. You know, I was active duty military stationed at Scott Air Force Base, Illinois. I had just got here in June, and maybe like October, November, I sneezed and it burned. I'm like, that's really weird. Right. And I'm like, okay. And then I did it again, maybe a couple weeks later. I can't remember because it's been 13 years ago. And it sneezed again. I sneezed again and it burned again. And I'm like, something not right. So I called my military doctor and I said, something doesn't feel right. I said, but I think it's my breast. And she said, no, breast cancer doesn't hurt. I said, well, I think it's something, you know. So she called me in and then she scheduled me for a mammogram. And I had already been getting mammograms since my mom passed away. And from there, from the mammogram, when the technician told me to sit down, I was like, wrong. Because usually the military tell you, okay, we'll see you, you know, in a year. If something's wrong, we'll notify you, you know. And when she told me to sit down, I was like, And the radiologist pulled me in his office and told me that day that I had breast cancer. He pulled me into his office. He pulled up my mammogram. He did a circle like this. And he said, you see that white stuff? He said, that's breast cancer. And that's how I found out from a sneeze. I went into the doctor for that.
Wow. Is that, and it was stage 4, is that correct?
Yeah, it was stage 4. I didn't know that there were, even though my mom died of metastatic breast cancer, I guess I don't know whether I didn't ask the right questions or I was just in the zone because she died, but yeah, it was stage 4. I went into first I seen a breast surgeon and I thought I would be getting a mastectomy, but of course, once you're stage 4, it kind of defeats the purpose of getting a mastectomy because it's already in your bloodstream. So my next visit was to a oncologist.
Right, right. And you started treatment quickly after
Yeah,
that.
21st of December, I started treatment.